Yeah. Yeah.
Okay, we're live.
We're live. There's nobody watching though. For now. Okay.
Bună ziua! Cu mine v-ați obișnuit deja, sunt managerul clinicii Medisprof. Ne aflăm din nou în secția de radioterapie a spitalului de pe Bulevardul Muncii. Suntem echipa profesională de înaltă ținută care ne susține și ne auditează și ne povățuiește în tot ceea ce facem în radioterapie. Vrem să facem o scurtă vizită a secției de radioterapie în care ei vă vor prezenta aparatele, secția. Va fi în limba engleză, dar nu cred că este o problemă pentru nimeni. Și o să las pe doamna doctor Alina Mihai, care este coordonatorul și șeful acestei secții, să-i prezinte pe partenerii noștri externi, profesionali, și să poarte acest dialog. O să fiu și eu prezentă. Și dau cuvântul ei.
So, good afternoon, or good evening. It is my pleasure to introduce Professor Dwight Heron and Professor Hack from the University of Pittsburgh Cancer Center. I had the pleasure to work with them for the last 11 years or more. I had the privilege to be taught by them about high technology, how important it is not only to have it to treat safe, to have that access to technology, to have personnel who can allow this kind of treatments. And I would like to show them that despite the fact that we are in Romania, where radiation and therapy is really not on the top of the priorities of this government, we have a center, hopefully they will agree with me, which is able at this point in time to offer the patients the best care in radiation oncology. So, Dwight?
Thank you for having me, Alina and Heron. First of all, it's amazing. It's wonderful to be here for the third year. And the last year when we were here, we were still under construction, and we saw the vision that you and the team here had to really radically transform radiotherapy in Romania, to really bring not only, radiation therapy, but frankly, state-of-the-art comprehensive cancer care to the citizens of Cluj, because these are, in fact, your neighbors, these are your mothers, your cousins, and so what you've done here in Medisprof is absolutely amazing in terms of the technology that you've brought here, in terms of the personnel, the training, the one-stop shop. This is a very patient-oriented, patient-friendly program. And I'm really proud to see that Alina have worked with you guys so closely to bring radiosurgical capability. This is the ability to treat tumors anywhere in the body with the accuracy of the tip of a pin. And this is something that a lot of places, a lot of countries don't even have. And I think the machinery, the technology that's here, the first TrueBeam STX with gating in Romania is here in no other place than Cluj. It's not in Bucharest, it's nowhere else. It is actually here. And I think you have the personnel to do it. So I'm particularly excited to see, and I know you're treating patients right now, and I can tell you this, if I were a patient coming here, this is an amazing, it doesn't feel like a hospital. It feels like really a home. I am going to a place, and you've done so much in the design of this to make patients feel right at home. And so I'm really proud to see that you've done, this is like a center that would be in the US. If you built this in the US, I would say, thank you. It's really wonderful. I'm sure the patients are giving you the same feedback in terms of, the feel of the place. Just look around. You don't feel like you're in a hospital.
You know why? Because I think that tomorrow, maybe it will be me.
Yeah, you never know. And you'd want to be treated in a place like this. So what are your thoughts, Dr.
I mean, it's just, you're talking about patient focus. Early on, you were saying how you brought the patients here and gotten their opinion as to how they want to really personalize this whole hospital.
From the beginning.
From the very beginning. And that's a concept I don't think exists here. You know, patient care comes first. And we are renaming this entire building by taking feedback from them. And look at the words. And you are telling me and telling us that this idea came from the patients. That they wanted to feel the freedom, you know, these hummingbirds. And you know, that's, you know, when they come here, they get treatment, and they know that they're getting the best care that actually in the world, as Dr. Heron was saying. You know, the technology that you have, I mean, we have those technologies, and that doesn't mean that, you know, anything, but it is really, we at UPMC, we love to stay on the bleeding edge of technology. That's what Dr. Heron likes to say, bleeding edge of technology, rather than leading edge. So, and you have exactly the same equipment. And you have the professionals who are being trained, Alina, Dr. Mihai, you know, I mean, she knows it all, surgery-wise. I mean, she's one of the leaders in Ireland, and you know, really has created a major impact in the radiosurgery world. And the professionals here are trained by her. You know, so really, you know, I think you have a great opportunity to really bring it to the population, that let the country know, you know, the capabilities of this place and how they will get they don't have to go anywhere else. It's right close to their home.
It's right close to home. And so I will say this, as the leader of the radiation oncology program and the international oncology program for UPMC, I will tell you that the technology that you have here, there are lots of centers in the United States that don't have this technology.
Great.
I'm gonna say that again.
Absolutely.
The technologies that you have here in Cluj, in Medisprof, is technology that lots of centers in the United States of America don't have. And so, as a program with, you know, we have 28 radiation oncology centers in the United States. We have centers in Ireland and Italy. We have relationships all over the world, cancer centers that we run. And I will tell you that the commitment, and I'll speak to the camera, the commitment to your care, comprehensive, world-class chemotherapy, radiation, imaging, laboratory, all those things, and in fact, those things that are important, like nutrition, those kinds of things. It's great to see, Carol, what you've put together here. And I'm actually really proud to be a part of, you know, this project in terms of seeing what's been done. So this is an amazing, amazing program.
The other thing that I've heard from you, we've been coming here quite a few years now, and you really are looking at it from a patient perspective. You say you're honest people, and you want to do good for the patients.
In Romania, that can be a problem.
That's what and that's what I wanted to bring out, that you mentioned that to us, that, you know, just because you're honest, you try to do good for the patient, and then you see a lot of resistance from the
just in general. So the bottom line, I think, if you are a citizen in Cluj, I would say this, you know, all of us, 1 in 8, at least in the United States, 1 in 8 individuals is touched by cancer. All of you, I guarantee you, everybody who's watching this video knows somebody or has a friend who has a mother or a father or a grandfather who has or had cancer. And I would say to you, if you're a citizen of Cluj, that you ought to talk to your politicians. You ought to talk to your family doctors. You ought to talk to your neighbors and say, why is it that we're not getting care? Why is it that there's a waiting list? Let's go ahead and get state-of-the-art comprehensive care right here in Medisprof. Again, thank you so much. It's always wonderful to see you. You've done a beautiful job here.
Thank you.